Hello, I'm Paula Hull. I'm Director of Nursing and Allied Health Professions here at Southern Health. We all know that over the last few years the NHS has struggled to retain staff and to recruit new staff. We have been doing a lot here at Southern Health to listen to colleagues about what's important to them about working here. What makes an organisation is the people within it, their beliefs, their aspirations, personally and professionally. So we've been listening to people to hear what their personal aspirations are, what inspires them, the sorts of environments that they want to work in, and talking to them about the challenges of working in really difficult situations. We've been really pleased that we've been able to develop the ACE Academy, the Academy of Clinical Excellence. It's for each and every nurse and allied health profession and healthcare support worker in the Trust. It's where they can get career coaching, where they can get education, qualifications and support with development in their careers. We're really starting to hear back from people that this is making a real difference to their working lives.
So I actually started working in admin. I kind of was completely new to mental health, and then I quickly learned that I wanted to be a support worker and then in the future a nurse. So I spoke to the management team and they were really great, kind of opened up a job for me. So I started from admin, then I went to a mental health support worker, and then recently I've just started my nurse apprentice mental health training.
We're also doing things like preceptorship, where newly qualified nurses come to us and get support, development and role modelling from other senior nurses to support them in their new roles. We've been going to colleges to talk to young people about their aspirations and careers in the NHS, and we've also been talking to lots of people that work here already who might be in a healthcare support worker role and might have aspirations to become a registered nurse or a registered allied health profession. And we've been absolutely supporting many of those individuals to go into those roles.
Hello, my name is Anne. I'm newly qualified mental health nurse. I've been working here for 9 months now. I started October 2022. I used to work as a support worker, then before I went to uni to study mental health nursing. All my placement was local here in Southampton. So there was preferences, like if you have kids, they will give you preferences. So my first placement was actually on Antelope House, Trinity Ward. Then I did a second one in the community. Then I did another one in older patient ward in Melbury Lodge. Then back to community. Then I did my final placement here. That's why then when I finished my final placement here, the environment was very conducive, very good place to learn. Then I decided to come back and work for them.
We are very lucky and I feel very privileged to have a large number of internationally educated nurses working here at Southern Health. We've worked really hard to provide them personal and professional support in coming to a new country, sometimes away from their families, and providing that support to them in an environment where they can learn about new population health and different experiences of delivering care in a different country. I have been amazed at some of those individuals, and some of them have already developed into more senior positions, and some of them have moved into roles such as practice educators. And one of those is Greg Hines, and he can tell you all about the amazing work that we are doing to support internationally educated nurses working with us and developing their own careers here at Southern Health.
Hi, my name is Gregory Hines. I am the Practice Education Lead for International Nurses. So we support the international nurses when they first come to Southern Health. We are involved in the OSCE preparation. The OSCE is the Objective Structured Clinical Exam. We have them prepared to pass that so they get the NMC registration. And then after that, we take them through the Trust's induction process. We involve them in an integration program which helps them to learn the skills to develop into UK nursing, and then we also support them with one-to-ones and supervision and everything else on the wards.
I'm George Gomez-Acrias. I am the present ward manager at Deer Leap at Leamington New Forest Hospital. I was at a point in my life where I did my undergraduation, then I did my master's in nursing, and I was looking at an opportunity to leave. And somebody on LinkedIn was very interested in my profile and said, would I be keen about moving to the UK? And I said, yeah, why not? Nothing wrong in trying. You have more than enough support. I'm the living example for it. I'm a brown dude from the south of India. From 35, 40 degrees, I've come here. I started off as a band 5. I'm a ward manager now. I also take my ward manager's responsibility more seriously for international nurses because I've been one myself. So I know what the gaps were, and I ensure that those gaps don't exist when my new recruits come. Asians or Southeast Asians are very hospitable people. We are very much, we see God in the guest that comes home. There's a Sanskrit word that we use where we say that the guest that come home is as important as God. So that filters through the care that we deliver. The patient is at the heart of everything that gets done. Whatever needs to be done to keep them happy, to keep them content, and to ensure that they are safe will be done. Moving from the Indian healthcare system to the private and then coming to the NHS, I can say this much, that the NHS is truly a national treasure. It's been 70 plus years now, and unfortunately it's going through a turbulent time. But however, all of us are here to make it work, and we will do our best to keep it serving the public. The UK in itself is a very diverse country. By having more internationals, the more diverse it becomes, the more inclusive it becomes as a system, treating everybody from every culture and every race and every creed. That will only make the NHS even more beautiful.
One of the things that we absolutely take time to talk to people about is their health and well-being. We've got a number of things like fast track opportunities where you can get MSK or physio support more quickly as a staff member. And we also do the same for some of our IAPT services if people require counselling or support or any psychological support while they're with us. It's really important people get their clinical supervision and their reflective time and their away time away from their team so that they can think about their role and how they fit in the team and talk about some of the concerns that they have. We also have things like whistleblowing and speak up to make sure that people feel that no matter what, they can talk to someone, and if they've got fears or concerns, they can talk about them. One of the things we have been doing are recruitment fairs. We've had over 10 so far in all sorts of different parts of our organisation, often in one of our units or hospitals. What we do at those fairs is we have people that are doing the job there to talk to you about what it's like to work in the NHS. And whilst I've been a nurse for 34 years, what I do know is the NHS only works because of all of the different people that work in it. Whether you're a cook, a cleaner, a porter, a senior manager, a physio, an OT, or all sorts of other administrative roles that we wouldn't actually be able to see patients in the way we do without them. All of those roles are available to you. We have many services with complex mental health needs through to community physical health services, children and young people's services. We have services for autism and learning disability. There are so many different opportunities with music therapy, art therapy, drama therapy. It's such an exciting place to work. So if you'd like to know a little bit more about any of those roles, please visit us at one of our recruitment fairs or have a look at our website and see what roles are available.